While employers worry about the cost of providing coverage for workers, we're just 6 weeks away from when state and federal health care exchanges are slated to be operational under the Affordable Health Act. One of the biggest challenges for administrators, getting the word out to people who may need to sign up for coverage, especially to young people, many of whom say that they aren't focused or even aware of what they have to do and spend to obtain health insurance. Bertha Coombs has the story.
In health policy circles, they're called young invincibles. Healthy 20-somethings who don't buy insurance, it's assumed because they don't prioritize it. But a new report from the Commonwealth Fund shows otherwise.
Affordability is really the key reason why young adults don't enroll in health plans.
Researchers found 2/3 of 19 to 29-year-olds they surveyed take up insurance when offered at work.
And among those who don't, 22% say that they couldn't afford the policy, and only 5% said they didn't sign up because they didn't need it.
15 million young adults in their early 20s are now covered under the Obamacare provision, allowing them to stay on a parent's insurance plan. And the survey shows the number is rising.
I plan on, using my mom's insurance as long as I can.
I'll stay under it until I'm 25 or 26.
And while so-called Obamacare remains controversial, the survey found politics doesn't enter into coverage choices. Commonwealth found 63% of those who identified themselves as Republicans were covered under parents' insurance plans, up from 54% in 2011. That compares to 45% of self-described Democrats, down from 50% in 2011.
What it says is this has been a long-term problem for all families, regardless of their political affiliation. Being able to come onto their parents' policy really did benefit young adults.
For 2014, the challenge is getting young adults who can't obtain coverage through their parents to buy insurance on their own. The Obama administration is hoping to sign up at least 2.7 million young people through state health insurance exchanges. Beyond traditional advertising, the Department of Health and Human Services is using social media to try to reach them. But they aren't alone. The Heritage Foundation has launched a counter-campaign to coincide with this fall's open enrollment on social media platforms to get young people to post pictures of themselves with the hashtag #StopObamacare.
We want to package the information in a way that the user, the reader, is going to actually be able to digest it. And we just want to meet those people where they are.
Both sides of the Obamacare divide will be watching young adult enrollment closely this fall because without their participation, the insurance market will suffer from adverse selection. That is, only older and sicker people applying for coverage, which ultimately will push premium prices higher. With 80% of uninsured young adults eligible for federal subsidies, Commonwealth's Sarah Collins expects to see strong enrollment, but the bottom line will be the premium price.
Affordability is going to be key.
For Nightly Business Report, I'm Bertha Coombs.